evening and good to have you with us once again here on the Urban Debate. Tonight we continue with our focus on India's vaccination drive, especially the phase 2 that now involves the senior citizens and those above the age of 45 with comorbidities. Today was day 1, a new day after the confusions that we saw yesterday, but confusions actually continued on day 2, which was today as well. Now, while initially there were technical glitches, some of those were resolved. But what followed was confusion over timings and overcrowding. Now, we're going to give you some of those details, and tonight we're also going to focus on what can be possibly the solutions. So the conversation tonight, viewers, the intent is not just to express anger or disappointment or whine about what's going wrong, but to highlight these issues with the intention that the authorities, the experts, the state governments, the civic bodies, the local administration, the central government, they take note of what's happening on ground and then they try and fix it. And I'll give you just a couple of examples, then also play out a conversation and a Q&A we had with the government officials today. But for example, there are glitches in the portal, and not just for the beneficiaries, but even for the administrators, those who are giving us the vaccine. And when the servers are down or the website becomes extremely slow, that hits the entire process. The entire vaccination process gets delayed. So what we saw was in a lot of places, manual registration was being done. Let me give you another example, and here we need a solution. This confusion over timings. People are getting different kinds of communication over the timing, their slot. Is it 9 a.m. to 5 p.m. any time? Is it forenoon or afternoon? Is there a specific time slot for different categories? When people don't know this, they land up early in the morning. And so you see overcrowding. One could say that why don't we have specific slots for specific categories and be clear in our communication that if you've registered and your registration has been approved, this is your center at this specific time and not an overarching 8-hour time band. We also saw long queues. These long queues included healthcare workers, they included the elderly, they included the pre-registered, they included the walk-ins. Because in many of the places, there are no separate timings, no separate queues or stations, gates, anything for separate categories. Then there are some centers who have decided they will not allow walk-in. Now, while as a policy, the government, central government has said you can decide and clearly say whether it's only pre-registered or also walk-ins on what days and times. But where is that information? And who's giving you that information? People have landed up in vaccination centers in the national capital only to be told they don't take walk-ins. So we need to know very clearly, where is it that these hospitals are publishing their information? Is it centralized? Is it with the state? Is it with the hospitals themselves? Who's going to tell us all of this? Now, we had some of these questions that we presented to the central government as well. We diligently follow their health ministry news briefings that take place and ask the questions that you want answers to. Here is what happened when we asked them about this confusion. Listen in.
I am Ayushman from Mirror Now. My question is to R.S. Sharma, sir. Sir, given the fact that you have said no glitches are there, we have seen the allocation time that is given to beneficiaries is 9 to 5. There has been report of crowding on every place where vaccination is being given. Also, sir, there are states where vaccination is starting late, like for example, Karnataka at 12 o'clock. Are you coordinating with the states? How is the time allocation process there? Because there is also second dose shot available there. How is the management taking place for timing and mix-up of on-site?
I think that's a very good question, and I'm happy to clarify that. What is happening is that typically we did not want to sort of divide the time in compartments, 1 hour, 1 hour. We could have done that, there's no problem. Typically what we are doing as of now is forenoon and afternoon. But if the capacity of the hospital, if they declare 100 people, then we can say forenoon, afternoon, 100 people, they will come at different points in time, there will not be much crowd. But if the capacity is large, we can always, put it, divide it. And in fact, we have given the provision, the software, that the hospital themselves can say this capacity is to be divided 2 hourly basis, 1 hourly basis. That we will incorporate, and I think we take that feedback, and we will, kind of do it in a way that when a person is given an appointment, we will say, okay, you are slotted for 10 to 12 slot and stuff like that. So I think that's a good suggestion, and we will, especially when the number of vaccinations which a hospital is doing is going to be large, more than 100, maybe 500 or something like that. We will not like crowding to take place. Thank you very much.
There's one more clarification to what Dr. Sharma has said. The COVID version 2.0 does not, and I am repeating, does not provide for a 9 to 5 vaccination session. It has done away with that timeline. So if a hospital has the capacity, the system permits the hospital to do vaccination even after 5. They can do it at 6, 7, 8, depending on their capacity, and they need to do it in consultation with the state governments. This has been briefed both to the state government as well as to private and public hospitals.
जस्ट वन मोर, एक और मैं जो हेल्थ सेक्रेटरी साहब ने कहा उसमें और थोड़ा जोड़ देता हूं. जो हॉस्पिटल्स अपना टाइम टेबल पब्लिश करते हैं उसमें वो ये भी देते हैं कि कितने बजे से कितने बजे तक हमारा हो रहा है. तो जरूरी नहीं है कोई हॉस्पिटल मान लीजिए सवेरे 7 बजे से लेकर 12 बजे तक कर सकता है, कोई समस्या नहीं है. इसलिए फ्लेक्सिबिलिटी इन टर्म्स ऑफ टाइम, फ्लेक्सिबिलिटी इन टर्म्स ऑफ स्लॉट्स, सब तरह की फ्लेक्सिबिलिटी अलाउड है हॉस्पिटल्स को. वो अपना पब्लिश करेंगे कि उनका क्या कन्वीनियंट है, क्या टाइम है, क्या लोकेशन है, वगैरह वगैरह.
So that's the detailed response we got from the government. Now, it gives you an insight as to what went into the planning to make it flexible, to give all of these options, to not be rigid, to let the last mile implementation decision be done by the last mile organization, the hospital or the local administration. But what has happened in the first 2 days, viewers, is that the beneficiaries, the citizens who want the vaccine, don't know all of this. They are not being communicated. So while the intent was to say we will not give specific timings, let them decide, somebody has to decide and tell us. Otherwise, you will have hundreds of people outside each of these vaccination centers at 9 a.m. every day, elderly, senior citizens, 60, 65, 70, 90, 97-year-olds who are turning up to get the vaccine. And they may end up waiting for hours. And that's not something that we want. This is one issue I wanted to highlight. Let's say good evening to the panelists who are going to help us come up with more solutions as to how we can streamline this process. Dr. S.K. Sarin, Director for the Institute of Liver and Biliary Service Sciences, joins us this evening. Dr. D.S. Rana, Chairman of the Board at the Sir Gangaram Hospital, joins us this evening. Dr. Vishnu Panigrahi, Group Head for Medical Strategy and Operations at Fortis Healthcare, with us as well. Thank you to all of you for joining us. Dr. Sarin, I think, while the center says they've left these decisions to the vaccination centers, how are the people going to know about some of these decisions, about different queues, categories or time slots? Right now, everybody is just turning up at random time.
Well, Tanvi, you have a very valid point, and especially when we're starting for elderly people. A simple way, I think the government has announced, it has come into the newspapers very well through your channel also, it has been advertised. But yes, a simpler way could be that every TV channel just gives a slot to a proper advertisement. Yes, this is the way it has to be done. That is the way you will go. But like for a polling booth, you know that the polling time is from 9 to 5, your numbers are there, and you know which station, which polling booth I have to go. The second thing we can do, besides advertising well on the TV or newspapers, is to, maybe the government is doing a lot, but they can also take up Aadhaar cards or, the basic registration for the UHIDs and give them, look, you are the people, you will be going there. You are the people, you will be going there. Now, if you do this kind of an approach, people will say, I don't want to go there. I want to go there. So for enabling people to go there, The easier way is to give the people an option. They have an app, they should fill it up. Don't try to go on the same day. The app is open 24 by 7. So you fill up your thing, you fix up your time 3 days in advance, and then you will be insured. So I think the initial problem has been because everyone wants to get on the same day earlier. That is the reason. But other than that, I think it is doing fairly well. But yes, do book your things well ahead of time and you can choose your center. I think it's a great thing, especially you're getting a free vaccine, you're getting a free jab. This is amazing that we are able to achieve this.
No, fair. Yeah, I completely agree with you. What we've intended to do, and it is going to be a big challenge for a country our size and the speed with which we are going, all of that are fair points. But Dr. Sarin, right now we don't know what time slots. When you register, it says 9 a.m. to 5 p.m. and it will give you a preference of forenoon and afternoon. And what the central agencies have done this time slot considering 100 people per vaccination center, because that's assumed to be the capacity for each. But we're not factoring in hundreds of people who are walking in, the unregistered one.
Yeah, normally the general feeling and the message communicated to all is that those who have done online are generally 9 to 3. Those who want to go on the spot or those who are going there without any prior bookings, they can go sit there, make their bookings, and that is between 3 and 5. So it is clear to us, and like at ILBS, we have 5 centers, a vaccination center, so we are doing almost 500 people. And there is no vaccine wastage. There is a proper organizational thing. I think what people need to understand is just one thing. My request is just book your things for a day ahead. Don't try to walk in. This is a very organized, programmed system. We want to assess for side effects. We don't want just to give a jab and let the people go. Half an hour he has to wait. So the administrator, the hospital, yes, one thing is the COVID, the app has to become a little more friendly. Maybe it is overloaded. So there are glitches, there are time lags in that. That is the thing which people have complained. Other than that, I think the system is okay.
All right. So you've made a very interesting point, and I want to check this with the other two panelists as well. Dr. Panigre, is this largely what everybody is following? That you get the pre-registered ones in the first half and post 3 p.m. Then you vaccinate the walk-ins, because at many of the centers that we saw, everybody was in the same queue.
Good evening, Tanvi. Thanks for inviting me. Today, across the network, we did about 996 cases, and the split is 45% were pre-registered and 55% were on the spot. And the registered ones were coming from morning till we are doing it up to 3 p.m. Post 3 p.m. are the ones who are coming on the spot. And to your point also, we are not turning away anyone. In fact, yesterday evening till late, about 7:30 also at Fortis Escorts Art Institute at Okla, the spot on registrations, they were getting the vaccinations done.
Has your group of hospitals published information separately about your vaccination centers somewhere, which tells people that these are the timings for these specific categories?
Yeah, we have
because I want us to put out that information, Dr. Panigre, because I don't think many people know that. They're only going with what the portal is telling them. This is your center, this is your date and time.
Even if you look at a small center like Faridabad, the Fortis Faridabad Hospital, they did 95 today, and only 5 pre-registered came in, and 90 were on the spot. So, no one is being turned away, and we have the notice there who will be coming the first phase, who will be coming the second phase. So we are pretty friendly, I think so. And across the network, even in Punjab, we started off yesterday. In Mohali, out of the 142. 40 were pre-registered and 102 were on the spot. So it is going off well, if I can say that way. And in Vasant Kunj, for example, everything was 132 was all on spot registrations, because they had some problem with the people came and said that we are unable to log in, and can we come here? So 132 were vaccinated at Fortis Vasant Kunj on the spot registration.
Okay, that's actually a very other point that I wanted to highlight, that many people have tried registering, have not been able to for a variety of reasons, ended up calling up the hospitals and saying, okay, can we just come and get ourselves vaccinated? So that's the other problem, which is why you're seeing more number of walk-ins as well. Just to give our viewers some perspective, and we are still waiting for the data for today to come in, but on day one yesterday, roughly about 25 lakh people registered, of which 24 lakh were beneficiaries from this new category, of which actually 6.6 lakh were the self-registrations. How many did we vaccinate? About 1.5 lakh, because many of these people would have chosen a later date, so that those vaccinations will only happen later. Today we're given to understand we've reached 50 lakh as registration number. Now, imagine how many of these are going to be walk-ins, how many people are actually getting it, registering themselves. So, the authorities will have to begin factoring in what here also Dr. Panigre is pointing out, that a large proportion, almost half of them are walk-ins, in some centers a lot more. Dr. D.S. Rana, let me come to you. Thank you so much for being with us. What is the system that you are following, and how are we informing the beneficiaries about this system?
Well, we are following the government guidelines, and we were told that till 3 o'clock we will continue to registered patients, pre-registered patients, or people, beneficiaries, and after 3 o'clock we will do walk-in. What the scene today, there are some glitches in the app, which you all know, but I think that will matter of pass very soon. And I don't think people are bearing with that. But even today we have 320 vaccine people, 320 people got vaccinated at our center at Sir Gangaram Hospital. Out of that, 285 were walk-in. So walk-in was also coming through a day, and registered were only, say, 35 or so. So I think people are getting registered. We are passing on information to the people that please get registered to make the life easy. And as Dr. Sivsrin told that we should encourage, registration is quite simple. But I think in another 3-4 days or 1 week, everything will be clear to people. Right now, they don't know. All the beneficiaries to our center came by phone. And we gave to everybody, and it was over by 5 o'clock. There was no problem, actually. It was very smooth and well appreciated.
Let me ask you another question then, and it's very interesting because all three of you have told me this, but I don't think the viewers know at all that there is a differentiation that the centers may be following, where they give preference to pre-register in the morning and then they do the walk-ins post 3 p.m. The walk-ins obviously will not know this. They are walking in because they are not accessing websites and they're not accessing the online system, which is why they are walking in. So I think we need to spread this word out that this is the system that many may be following.
We need to spread this message, and we also need to spread that more and more people should walk in. Today, let us say, right from the beginning, people were walking in Gangaram Hospital. So we continue to entertain both, It was not strictly that we refused the walk-in patient before that, But of course, there were little more after 3 o'clock. But throughout the day, we continue to entertain both who were registered and unregistered, because our quest is to do almost 1,000 per day. So we do it only 320, so there is no problem,
Okay.
But I fully agree with you.
Yes.
Through media, electronic media, or printed media, and from also hospital sources, we should encourage online registration, and that will make the life very smooth and not very taxing at the center.
Yes, Dr. Panigre, you wanted to add?
Yeah, what I would say is that what Dr. Sareen rightly mentioned is that pre-register and come, and so that's the best way. But at the same time, I would like to reassure through your medium to the public is that no one has been turned away, even if they have come before the 3 p.m. time. So they are not registered. We are taking care of them, and no one is turned away, because a lot of times the people who are coming on the spot are elderly. So we have to take care of them. So that reassurance is there. And let us not create panic if I say that. I think so. It's a huge exercise that the government has undertaken, and the public and private sector have really come forward and taking it forward. So, your media, we must thank you all for spreading this message. And the message is that please register. If you have not registered, unable to register, go to your nearest hospital that has the vaccination facility. They'll be taken care.
So, may I ask this question? Is this, the instruction or the system that you are following, if it's come from the government, is this the central government or the state government? Because the central government tells us that they've left these decisions on timing for the walk-ins and for the registered, and even for those who are coming for their second dose and the healthcare workers, they've left those decisions to the hospitals and the state governments. So I'm just wondering, how do we figure out a centralized way of putting out this information? Dr. Sarin?
I think this has been communicated by the central government, in my knowledge, to almost all the states and the state governments. And the state governments have informed all the vaccination centers and sites. To my mind, it is very clear from beginning. Maybe there is little more need to get more publicity of this message. But remember, if you are self-registered and one mobile number, you can register 4 people. So it is very easy, like your wife, your daughter, your son, whoever is there, they can register 4 people with one mobile number. So if you have registered, you are so comfortable that you just have to go to a given hospital. The registered people are between 9 to 3. Remember that going early in the morning doesn't mean that you will get it. So be a little patient, have your breakfast well, go a little while when the rush is less, so you won't have to wait as an elderly person. But for others, and also it is self-discipline that the people have to also follow, that those who have not registered may go between 3 and 5, whatever, you can extend the time. So there is a clarity. Also, those who have got their first shot earlier should not mix up. They generally should go into the afternoon. I must say that, and we have forgotten this, and I want to stress, every other country has vaccine shortage. India is the only country which probably has vaccine surplus. So we have now 50 lakh people registered in 2 days. We have the vaccine available for all of them. Now is probably the time that we increase the vaccination centers slowly, so we can vaccinate. People have registered. We have the vaccine. Now we just need to expand it with patience, with careful observation for side effects. And I think we can achieve the milestones. One more thing I want to say, people who are not literate, like in villages where there are elderly people, I think it is the time that the society should put up some people who are well educated, who can help the people in a village, in a community to get registered. There is no shortcut to having a society which works together for a common aim. So I think through you, I want to communicate, let the people in the society help those who are not literate, who cannot register, who are not app friendly, to help them to get registered or take them, fill up their forms and get them vaccinated.
Okay, the other issue I wanted to, discuss, and maybe Dr. Rana, you can come in here, because we've now spotted this in a couple of centers in Delhi itself, where the centers have decided that they're not going to, give vaccines to walk-ins, and that they're going to only vaccinate pre-registered. Now, we were going through the regulations that the center has given, and the center regulation does say so. The operative part is, it is recommended that to begin with, based on local context and plan, one particular vaccination center may either be fully reserved or their full capacity is opened for online self-appointment to avoid confusion and problems in physical queue management. Now, if that is the case, and this decision has been left to the hospitals or the vaccination centers, again, how are people going to know about it, especially the walk-ins?
I fully agree with you that there should be proper dissemination of the information. But let me assure you that it will take only hardly 1 week when everything will be known to everybody. And Dr. Singh told that more centers will be coming up, more awareness will be coming up. Eventually, people will be getting registered only. But right now, no hospital should refuse actually if they have got capacity. Like we have got capacity, so though we were supposed to vaccinate only pre-registered people till 3 o'clock. But as I told you earlier, that at Sargangaram Hospital, only 35 people can turn out turned out to be pre-registered through a day. 285 people just walked in, and he never refused anyone. So right now, situation is that for next 7-10 days, centers should utilize their full capacity, and they have been given flexibility by both state and central government. If they can do in the morning also, in the evening also, they can extend hours also. So automatically through your media and through person to person, people will learn within the next 7 to 10 days. And things are very, very nicely planned. And I think it is right now also, people are not making any noise in the center. I don't know other center. People were very appreciative. People realize that there are some glitches, but they never made any noise of that also. And they were quite happy getting their jabs. So this is good that you are disseminating this information also to your media only.
So let's yes, and I understand what you're saying, and I will also emphasize on the fact that this is not to say that people are disappointed or upset, but we're just trying to make the process simpler and put out as much information as we can for everybody. Now, so Dr. Panigrahi, are these conversations and is this kind of planning being done at the vaccination center level, private or government, or in conversation with the state government? How are we going to go about it in the coming days as well? Now, at some point, I'm hoping the hospitals decide that there are separate queues for the elderly, the pre-registered ones, the walk-ins, separate queues maybe for those who are coming in for their second dose. This streamlining of process, has this been left to the hospitals themselves?
To answer your question directly, initially the second registration process has been a bit sluggish, so we are getting more walk-ins. But as the registration becomes more systematic, we expect more walk-ins to come in. So the spot registrations will happen after forward. And that, but at this point of time, since the registration ones are less, we are taking walk-ins earlier also. And the state governments have given us the vaccination rights, and they don't direct us that you do it at the way you think that is the best. And all of us are working for the patient, so we are doing it the way that the patient gets the best care without any discomfort.
In fact, since you raised that issue, let me also ask Dr. Sarin this question. Dr. Sarin, the issue right now from our end has been largely about how the beneficiaries are having their interaction with the CoWIN website. But we're also given to understand even for the vaccinators, the entire process has been a little slow. Now, what are the kind of glitches that we faced, and I know that these are gradually being resolved, but that's obviously been a bit of a problem in the first couple of days.
Yes, there are some glitches which have come into the software or maybe the app. Like you fill up the registration, it doesn't, normally it should come up if the system is working well in 2 to 3 minutes, but sometimes it takes much longer. In fact, like today morning, there were long lapses in the system. There were problems in getting people registered, and sometimes your name comes and it disappears. So these are initial software things which have been noticed today as well as yesterday. I think people will have to have some patience. Like 50 lakh people getting registered in 2 days. What a software can do. Which country would have such a software which will be foolproof? So the administrator is also having, and we have people who are fully conscious of these things, and they do take their care. They make the people comfortable. They tell them, look, another 5-10 minutes. Yes, people want that, please fill up our forms, and also without entering into the system, give us a jab. That is not possible. You fill up, you get registered, you get a slip, you take the slip to get a vaccine. That is the process. I think you do it for voting. Sometimes when you go for polls, for voting, the voting machine doesn't work. You wait. So here you are getting a jab, even if you have to wait a little bit, which has happened because the administrators are unable to register. Well, I think in a day or two, it should also be over.
My last question, and I wanted to ask this to Dr. Panigrahi. Dr. Panigrahi, because in a lot of cities, many of the private hospitals which are empaneled, which are going to be vaccination centers, haven't become active yet for phase 2. And I know this, for cities, at least in Mumbai, even in Pune, in Bengaluru, which is why when citizens go on the website and select those centers, it just says it's full. But it's full because the centers have not been activated. Any idea on how quickly will we be able to ramp up these vaccination centers?
Yeah, you're right. In fact, for the Mumbai clusters, we have 4 hospitals there, and in Bangalore 5. And we were expecting it to start today or tomorrow, but it has still not come through. And the latest thing is that by tomorrow, I think so, we should be getting the news to start off. So that is the latest that I've got in the evening. So you're right. In the Mumbai and Bangalore clusters, we have not been able to start there. In Chennai, out of the 2 hospitals, 1 hospital we already started. So it's happening, but it's not happening universally across all regions.
Right. Yes, okay. So at least by tomorrow or day after, hopefully we will have, and I think that's largely the story across many cities. And people, are wondering because when they try to get the date, it just says it's full, it's not available for next 15 days or 3 weeks. And that's because these centers are not even active right now. So once that happens, the crowding problem will also hopefully get resolved. Many of these issues, and I just want to quickly run through them one more time and highlight the fact that the government also now has acknowledged that yes, we didn't give specific times because we wanted to leave it to the people, did not want to micromanage in terms of giving the specific slots. But if it is leading to overcrowding, maybe we will look into it. So beyond the 9 a.m. to 5 p.m. forenoon and afternoon categorization that has done, the government needs to look into, and not just the center, the states, the city administration, the civic bodies and the private hospitals need to look into this, ensure that people are giving specific time slots and they're given the same time in all of their communication and not multiple timings. Need to ensure that the slots are different for pre-registered and for walk-ins, or at least the queues are different for pre-registered and for the walk-ins, and this is informed to the people. There is really no point if the planners in the central government know it and the hospitals know it, but the people don't know it. Everybody is then going to just turn up at 8 a.m. or 9 a.m. there and begin to crowd, and those visuals can be really scary. You don't want your vaccination centers to actually end up becoming your COVID spreader events. So we need to quickly move into this, organize this better. If you are going to be one of those vaccination centers that does not take walk-ins or only takes walk-ins after a specific time, that has to be somehow informed to the people. Cannot assume people know what you internally know or have discussed with the government. Thank you so much for joining us on this conversation. We're going to keep a very close eye on as the vaccination drive proceeds into day 3 tomorrow. We'll get you all of the data, all of the ground reports, and how the authorities are trying to streamline the process. Thank you for joining us.